Okay, so basically, a child, a toddler, 2-year-old has, presented to you with a history of flu that occurred 1 week ago. So, you can see that there is a history of an infection, a preceding infection has occurred. Now, on presentation, the baby is constantly crying, especially when, the mother says that when she, touches the right limb, let's say, right limb of the baby. So, you are like, maybe there is pain. And also there is, visible redness on that side. Okay. And so this is some pathology of the hip. There's redness. So you can, come up with the differentials that there can be, something acute going on with that joint. And then you go for the ESR, and the ESR is high. Okay. And so what are you going to do? The management plan would be, of course, you will go for, CBC and the acute phase reactants that we have already checked the ESR. And for the joint, you can go for an X-ray and, all those investigations. But let's just say that the findings support that there is a case of, this is a case of septic arthritis. And it has presented, acutely. It usually presents acutely. But it's, a very acute, severe presentation in a child, 2-year-old. How are you going to approach? What are you going to do? Are you going to, go for further imaging, X-ray, MRI, or are you going to, aspirate the joint, or are you going to do an open washout under general anesthesia? So for children, what is the algorithm? The first thing that you're going to do is that you're going to aspirate, of course, aspirate the joint under, fluoroscopic guidance. And after aspiration, you're going to see that is the aspirate purulent, which signifies that there is an infection going on. And if the aspirate is purulent, you are going to go for an open washout. Now, the question is, why are we going for an open washout when we have already aspirated? What is the, the point of giving general anesthesia and doing a proper, surgical open washout? Why are we doing this? So the reason we are going for an open washout in this case is because we really don't want to, take a risk of any residual disease. So in order to get rid of all the residual disease, we go for this open washout under general anesthesia in the operation theatre. And after this, we insert an indwelling catheter. An indwelling catheter is to be inserted for almost 6 weeks, to supply IV antibiotics, and after that, you are going to shift the child to oral antibiotics also. And for how long are you going to give oral antibiotics? For a total of 6 weeks. You are supposed to give, okay, let's just talk about Doger. Doger says that the medical treatment is divided into 6 weeks. Okay, and for the first 2 weeks, you give IV, first 2 weeks. And then for the next 3 to 4 weeks, you give oral. Okay. So this is the not sudden, but the overall summarized management of septic arthritis. Always remember that in management, you also have to mention investigations, okay? And then you have to go for the treatment. So the take-home message is that surgical management is preferred over medical management in case of septic arthritis in children. And on surgical management, we go for open washout, and then we use an indwelling catheter to supply antibiotics.